Hello friends, today we are going to discuss about World Health Day 2023. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about World Health Day 2023, this year theme, evolution of this theme, understanding about this theme, and what is my role in contributing to this theme. In 1948, immediately after the Second World War, many countries came together. That is, League of Nations got together and United Nations was formed. During this time, even World Health Organization also came into picture. Here, World Health Organization was formed to promote health, keep the world safe and serve the vulnerable so everyone, everywhere can attain the highest level of health and well-being. Since its formation in 1948, now in 2023, we are celebrating 75th year of formation of World Health Organization, my dear friend. So it is very important to understand that this being a 75th year, they have come up with an important theme. Let's discuss about that. Every year on 7th of April, we mark the anniversary of founding of WHO in 1948. World Health Day is celebrated annually. Every year on this day, World Health Organization draws important, specific health concern to the people around the world so that they can come together, think about it, and work to reduce the disease burden. As I mentioned, this year is 75th anniversary. Hence the theme is Health for All. That is the World Health Day 2023's theme, my dear friend. Now let's understand what is the meaning of Health for All. That means, will World Health Organization will give health to everyone? Is it possible? Whether health is a commodity? Let's understand this theme, Health for All. Health for all means that the health is brought within the reach of every citizen in a given country. However, please remember, it is not just providing health services. It is a personal state of well-being that enables a person to lead a socially and economically productive life. Health for all implies access to health care. That means human resources, important or essential drugs, health facilities, vaccines, and procedures. Not only that, removal of malnutrition, health awareness, clean environment and sanitation facilities, safe and palatable drinking water, disaster preparedness and mitigation, place to exercise and recreational, mental health and spiritual space, and also enabling health for all, policies and laws promoting this important cause. That means we are talking about social determinants of health. The health starts from food, access to health care, important housing, mental health, transportation of a person, food, agricultural needs, education, so that health awareness, income and job, and not to be isolated, being social animal, and also safe environment. That is very essential, my dear friends. That means health for all means working towards the social determinants of health. Health does not exist in isolation. It is influenced by a complex of factors such as environment, social context, human behavior, economic factors. All these are interrelated, my dear friends. Hence, we need to act collectively so that social determinants are uplifted. Not only that, there should be a paradigm shift in thinking. This is not only from the political angle. Every citizen should understand this. Health for all means that the health should be regarded as an objective of economic development and investment, not just an expenditure. You talk to any political strategist or a policymaker, health means they think it is an expenditure. It is not at all. It is an investment. Investment of my future, your future, and every citizen. Not only that, it is an investment of a healthy environment for our children, my dear friends. Health for all is thus an holistic, multi-sectorial concept calling for efforts in agricultural field, industrial field, education, housing, economic domain, communication, and it is not just medicine and public health, my dear friends. Health for all envisions that all people have a good health for fulfilling life in a peaceful, prosperous, and sustainable world. Health is a basic right, my dear friend. It is a fundamental right. Every citizen should demand access to healthcare services, and also social determinants of health are uplifted so that nobody falls below the financial hardship and in poverty, my dear friends. Evidence shows that healthcare system powered by primary healthcare approach is the most effective and cost effective way to bring services for all in the near the doorstep, my dear friends. That means a primary healthcare that is focused on health promotion and prevention should be the primordial importance should be given. Not only that, my dear friends, we need to think health for all from primary healthcare perspective. Let's understand at the primary healthcare center what should be done. Here we need to talk about all ranges of services to be provided. It's not just allopathy, even Ayush, so that the people can choose what they want. OP services, inpatient services, free essential medicine should be available at primary healthcare center, rehabilitation services, community health services, telemedicine, priority for health with regard to person with disability, and we need to think through lifetime approach, that is from womb to tomb services, my dear friend. That means from perinatal care to the geriatric care should be planned at primary health center, not at the tertiary health care center. Let's understand how it has to be done. If this is PHC, we need to think of access to healthcare services so that PHC should be formed near the house of people so that they can easily access it, and it should be affordable. Poor people should get free access and affordable healthcare, and it should be sustainable. It is not that one year you give free services, next year you charge them with heavy bill. That is not sustainable. Community participation is essential at the primary healthcare, my dear friends, and it should be adequate quantity and quality. That means you have to provide a good quantity of healthcare. At the same time, quality should be ensured. It should be appropriate to the community, and finally, acceptable to the community. This can be done through community participation, my dear friend. That means health services there should be equity in this. That means there is no discrimination with regard to providing health services or social determinants of health. There should be adequate funding compared to other services. Priority should be to the health, and it should be progressive. That means it should be evidence-based health provision should be done, and it should be community participation focused more on preventive and promotive healthcare should be planned for the next generation, my dear friends. Now let's understand the history of health for all. As I mentioned, health for all is not a new concept. It's a very old concept. If you look at the history of health for all, it was the declaration of Alma Ata in September 1978 when they declared health for all by 2000. It was an amazing concept, but this concept had its own promising field at the drawback. It was the occasion of World Health Organization, the United Nations Children Fund, and 134 signatory nations came together to declare health for all by 2000. You need to remember, this was in 1978. It was at the heights of the Cold War, my dear friend. Although the health for all was conceived in 1977, but you need to understand why it failed. As I mentioned, it occurred in 1977. There was a lack of conviction and commitment by several countries. There was poor political will. Alma Ata Declaration was a part of USSR, that was Kazakhstan. There the health for all was conceived. Since it was conceived in USSR, many capitalistic world, that is, including USA and UK, they thought this is a communist ideology. Health for all is not possible at all. Hence, they thought this communistic ideology or a Soviet ploy against the capitalistic idea, hence it was discarded. Health for all became an idealistic goal or a dream or a Cold War ploy was the thinking at that time. Providing primary healthcare means promoting inexpensive intervention made it look like third rate medicine or third world countries medicine. Think about this. The capitalistic world thought that we need to provide healthcare in a big building, in a tertiary care center. Primary healthcare, providing healthcare in the community at home was discarded completely. They thought that it is a communist ideology. It is a third rate medicine. Third world country thinking was the name given to it. Though primary care was inexpensive, but the capitalistic world thought of providing expensive care in a tertiary center. Hence, this pragmatic view over ideological differences came into picture. Although public healthcare is affordable, but the capitalistic private healthcare started to take over because capitalistic world started to pump in money with regard to providing healthcare in tertiary center, in big hospitals, in cities. Healthcare became commercial. Medicines were sold. Even today, water is sold, air is sold, oxygen is sold. These are the nature's elements which should be freely accessible to everyone. Unfortunately, we have made everything as a commodity. Specialization centered healthcare center became the center for health, not the community health center. Professional bodies, specialist bodies started to fight for their pie. They thought against the public health policy. Till date, if you ask any specialist, they would like to provide healthcare in a glass house, in a tertiary care center. They do not want to provide healthcare in the rural area. If you look at the industry, such as pharma, infant food, cosmetics, tobacco industry, drug industry, alcohol industry, from commercialization to advertisement, have become capitalistic, my dear friend. Hence, health for all failed miserably because of the ideology of capitalistic, my dear friends. That means health for all failed miserably. But however, after 2000, there was Millennium Developmental Goals which came into picture. Although there was a renewed vigor and funding, but still, Millennium Developmental Goals was propagated from capitalistic world through capitalistic lens. It focused on secondary and tertiary care, not on the primary care. Hence, many countries could not afford this secondary and tertiary care. Poor planning, negligible investment in public health and primary care, poor infrastructure at health was exposed completely during COVID pandemic, my dear friend. During that time, we realized the importance of health. Not only that, importance of primary health care, providing health care at home, that is, providing COVID care at home, became the norm. and only those severely ill required hospitalization. The main reasons of this MDG becoming failure was the investment was poor, focusing on secondary and tertiary care, lack of evidence from public health policy, and investment failed. Hence, on the 75th year of WHO, Health for All through primary health care is becoming again the reality. We need to work together, all my dear friends. On this 75th year, we need to understand 30% of the global population does not have access to healthcare, even in US and UK. Hence, we need to break the barriers that hinders the access for health for all, and we should make it real, my dear friend. It is not just access to healthcare. We need to focus on social determinants of health, my dear friend. Now the question is, what is my role? How can I contribute? Please remember, health for all means all for health. That means every citizen should work towards health for all. It is not just the participation of doctors or nurses. It is the participation of every citizen, every country, every ministry, every department should work. There should be a strong political will. Laws, policies, allocation of resources, focus and sustained drive with regard to health for all should be the goal. The ideology of health for all prevails over the capitalistic idea for health for only the secondary and tertiary care should be disregarded, my dear friend. Infrastructure development, that is organizational, physical infrastructure, institutional infrastructure, research, human resources, roads, communication, power and environment, all these should be kept in mind for health for all to be realized. There should be investment from the perspective of time, resources, law implementing agencies, education, awareness, and preparedness is an important concept we need to understand health for all. There should be public education. Health should become an important ingredient for election manifesto. That means every citizen should demand for health for all, and social determinants of health should be made important component of every program. Clean environment, pollution free air, water should be the goal of every citizen and every country. Urge politicians to invest in health, invest in education, invest in justice. Community involvement is the key ingredient for health for all, my dear friend. Redistribution of health resources should be done. That means focusing on rural health, primary health care, public health approach, prevention and promotion should be the formula. We need to defocus from tertiary health care. We should start decreasing building huge buildings in the urban area. We need to distribute these health resources in the rural area, primary health center, wellness center, at the village, at the sub-village, or even at the taluka level should be planned. Cooperation for health should be the way, not confrontation. We need to distribute, share health technologies, resources, and vaccine. Use technology to reach people. Telemedicine, e-health, health applications, artificial intelligence, metaverse, chat GPT should be used to provide health for all. We need to think about this 100 times, my dear friend. We need to cooperate for health, not confront. Confrontation means, that is, distributing weapons, killing everyone. Think about this world. We need to distribute vaccine, especially during COVID time. We need to distribute technologies, share technology, but not the weapons. Unfortunately, this world has become very mean and capitalistic. We are thinking about investing in military, weapons. We do not think investing in health, education, and justice. This capitalistic ideology of investing in weapons, medicine should be discarded. We need to think for health for all from a socialistic perspective. Every citizen needs to ask this question and also plan for yours future, my future, and future of our children. We need to stop this world from war. We need to think of peace, not just health for all. Health for all is an ideology where a peace prevails, sharing of technology, sharing of vaccine, availability of medicines, availability of social determinants of health for everyone should become the prime goal in every election, my dear friends. And this, an important concept from the Sanskrit phrase, Vasudhaiva Kutumbakam. That means the world is a family. That is the way to go around, my dear friends. I'm very proud. In this year, G20 presidency, my country is leading, and it is talking about health for all and all for health. That is one earth, one family, one future. That is the way to go around, my dear friends. To summarize, health for all for health. Stay safe. Thank you for giving your valuable time.